Okay, hinge point training mini class. So in this video, we'll be going over hinge point training and combining it with some articulated cat-cows and spinal cars, right? So there will be 2 rounds, and we're gonna start with tall kneeling spinal cars, some articulated cat-cow just to warm up the spine and get a feel for what that's like. Do some hinge point training, run it back with some spinal cars, cat-cows, do a second round of hinge point training, and then finish it off with more cars and cat-cows to kind of see how the spine feels after the hinge point training on both rounds. All right, so what you'll need is a yoga mat. I have a timer in my hand for myself to keep me on time, and whatever you use for hinge point training, again, I recommend one of these square erasers, element pack, whatever it is that you do. All right, so to get started, we'll get started with spinal cars, right? So tall kneeling position. So glutes engaged, trying to keep everything still from the hips down, arms across, and we're going to go into flexion. From a flexed position, we're gonna rotate, laterally bend, up and around. Rotate, lateral bend, swing it through, and then continue on that direction for rep number 2. Each rep, fighting for a little more. Swing it through, that's rep 2. Pause at the bottom to finish out rep 3 and switch directions. And that's 1. Again, moving 1 mile per hour, nice and slow, nice and easy. Warm up reps. Once we get done with round 1 and round 2, you can increase not the speed, but slow down the speed and increase the intensity. And we'll get 1 more here. Up and around, and swing it through. Good. Coming down in our quadruped position, just get 2 or 3 organic cat-cows here. And then go ahead and drive those scaps forward. Maintain that scapular protraction. Drop the head, round out the back, tuck the hips into cat position. And from this position, you're going to pull the tailbone back, go into the lumbar spine, TL junction, low thoracic, drive the scaps forward, mid thoracic, upper thoracic, head comes up. Tuck the tailbone, round out the lumbar, TL junctions, gaps go forward, round out the thoracic, let the head drop, pull the hips back, drive the scaps forward, chest comes up, head comes up, tuck the hips, round out the low back, TL junction, thoracic spine, and head drops. Good. Now, on your back, grab your eraser, whatever it is you use for your hinge point training. Grab the timer, and you'll follow along with me. I've got you on time. So get that eraser just below the TL junction, just below the rib cage on the spine. All right, once you're in position, drive into it, just to kind of feel where it's at, feel that feedback, feel exactly where you're going to be working. And hinge point training starts in 3, 2, 1, go. So doing our best to get as heavy as possible into the eraser. Find your end, fight for more, and then come off of it. Try and get light on the eraser, try and round your vertebrae around the eraser without the hips coming along for the ride, without driving your head into the ground. Find your end, fight for more, and then back down. Back and forth, very gently, with effort at the end range. Find your end, fight for more. Try not to drive your head into the ground, try not to tuck your hips. If your hips are coming along for the ride and you find that you can't not move your hips or other parts of your spine or your body or your head along with the end range flexion and extension, again, totally fine. We're doing what we can and working towards being able to come off the eraser and into the eraser without any further coupling or compensation. And time. Go ahead and bring the eraser down a vertebrae or two. So roughly the middle of your lumbar spine. Find it, get that feedback, know exactly where you're working. And starting in 3, 2, 1, go. Drive into it. Try not to tuck the hips. Try not to use your head as an anchor point. Find your end, fight for more. And then come off. Find your end, fight for more. And back and forth at your own speed, but just know that we're going nice and slow and with control and really focusing on only moving the vertebrae around the eraser and the point that you're trying to move. Again, we're not able to only move a single vertebrae joint at a time. Obviously, some above and below are going to come along for the ride, regardless of how skilled we get at this. But what we don't want is that if we're targeting the upper lumbar, mid-lumbar region, we should be able to round out without the pelvis coming along for the ride or the thoracic spine coming off the ground as well. And time. Go ahead and bring it down. Low lumbar. Find it, move the pelvis around, really get the feedback of where it's at. Of course, pelvis is going to come along for the ride slightly on this one. And 3, 2, 1, go. Drive in, find your end, fight for more. Pull off as much as you can, find your end, fight for more. And back and forth at your own pace. Being sure to breathe. Doing our best to keep the rest of the body relaxed. Got another 10 seconds. If you feel your body shaking, that's fine. This is a novel movement for a lot of people. More control, more strength, more ability will come with time. 3, 2, 1, and time. Good. All right, rolling off to the side. Bringing the eraser up to low thoracic, just above the TL junction. Find out where that eraser is on your spine. And starting your hinge point training in 3, 2, 1, go. Driving in, getting heavier, trying not to tuck your hips, trying not to use your head as an anchor point, coming off, rounding above the eraser, trying our best to not bring the whole lumbar spine for the ride, and then driving back down. Back and forth. Halfway there. This is an incredibly humbling experience. Much more difficult than people realize. But again, rebuilding the new neural pathways, creating a stronger cortical map of what we have access to, allowing our brain to understand where our spine is at segmentally in time space. And this will get easier and easier over time. 3, 2, 1, and time. Bringing it up ever so slightly, probably about 2 inches, 2, 3 inches. Thinking mid-back, mid-thoracic area. So just at the bottom of the scaps, maybe mid-scap for some of us. That's all right. Starting in 3, 2, 1, go. Whichever direction you may be going, making sure you're getting into your full flexion or extension, finding that end and seeing if you can get a little stronger isometric contraction at the end, and then coming down into the opposite direction. Breathing, trusting the process, halfway there. Again, especially when you're coming up into that extension, trying to round above the eraser. Again, not driving your head into the ground. 3, 2, 1, and time. And then bringing the eraser up just a little more. I'm gonna have to find mine. Bringing it a few vertebrae below that CT junction. We're thinking like upper thoracic. Find it, feel that feedback, and go. Driving in. And as stated in a previous hinge point training video, the higher you get on the thoracic spine, the more difficult it may become without compensation. Lower you get on the lumbar spine, the more difficult it may become. And that's not objectively true. Some people and their pathologies or their neural connection, that may not be true, but for most people, that is the case. A little over halfway there. Find your end, fight for more. Five seconds. And time. Good job. All right, now come back up. And now we're going to, the eraser actually in my shirt. Now we're going to come up and get in our tall kneeling position, and we're going to be doing 5 reps in each direction of our spinal cars. Engage the glutes, coming down into flexion, and we're just going to see if it feels any different. Rotate, lateral flexion, extend, rotating to the other side, swinging it through for rep 1. 2. 3. And of course, you don't have to go at my speed. I wouldn't go any faster than this, but if you really want to slow down, that's 4. I would encourage you to do so if you're feeling up for it. But I wouldn't go any faster than this. For me, that's 5. I'm going to pause and switch directions. And again, every single rep, seeing if you can squeeze out just a little more rotation. We're not strongmanning it. That's rep 1. I'm not forcing my way into the end range. I'm not shaking. We're not getting shaky reps because we're trying so hard, but seeing if you can get another millimeter out of the rotation, the bend, the extend. Three. That's 4. Last one. Trying to keep your shoulders out of it. Don't shrug as you come up and around or down. All coming from the spine. That's 5. Good. Now, coming into our articulated cat-cow position. We're already warm, so you can go ahead and round into cat, drive those scaps forward. And you're going to pull your hips back. Lumbar spine, TL junction, drive those scaps forward, extend the thoracic spine, head comes up, tuck the hips, round the lumbar, TL junction, thoracic, head comes down for 1, pull back, chest comes up, head comes up, tuck the hips, round, thoracic, head comes down, 1 more, pelvis comes back, belly button comes forward, down, extend, up, and then tuck the hips, round the lumbar spine, thoracic, head comes down for rep number 3. Good job. I would encourage you to run it back and do that again. Get in your hook lying position. You can rewind the video. You can pause the video altogether, stop it, start your own timer, and start implementing yourself for a second round. And if you're already doing hinge point training, combining it with the spinal cars and articulated cat-cow before you start and then after both rounds is only going to, again, create a better cortical map, get more synovial fluid and blood flow into the spinal region to help accelerate the healing process and to increase your control and overall mobility. I hope this helped, guys. I hope you enjoyed it. Please reach out if you have any questions.